Okay, so it is 10 o'clock. We'll get started, and I am going to record this. So, just to let you guys know that it will be recorded. I'll give a quick introduction of Nicole. So, Nicole Ottenbright graduated as a physical therapist from the University of Saskatchewan in 1994 and worked for many years in adult neurological rehabilitation at Wascana Rehab in Regina. Nicole has a love of teaching, mentorship, and a desire to give back to students. She has done this primarily as a clinical instructor and, in fact, has been recognized for her excellence as both a clinician and a clinical instructor. A few years ago, she left clinical practice for a short period of time for a management position with the Learner Placement Unit in the Saskatchewan Health Authority. Here, she worked to facilitate and promote all student placements in all health professions across the province. She has recently changed positions again and is now the manager of the complex care unit in the Saskatchewan Health Authority. And just personal note, Nicole and I used to sit on the practice-based assessment together when after COVID, when physio students couldn't do their practical exam anymore. So that is how I have known Nicole, all virtual. Every time we've seen each other, it's only been virtual. However, this morning, Nicole is here to speak with us from a personal perspective. After being diagnosed with breast cancer and subsequently lymphedema in 2015, Nicole will share her own unique story of being a physio and living with lymphedema, providing a patient perspective. So let's all give a warm welcome for Nicole Ottenbright.
All right. Hi, everybody. Good morning. Nice to, I can't see it through the screen, but thanks for the warm welcome, Melissa, and we'll see each other in person one of these days. Exciting day for our province today. It's the Grey Cup Parade in Regina this afternoon. So it's a good news story. And on the note of our topic, I had my annual mammogram last week and all was clear. So I'll give you the end of the story. I'll ruin the end of the story, but I survived, so I'm here to tell you my story today. Um, Main comment is that this is my own perspective, and I know a lot of you folks would have your own either personal cancer experiences or your family or friends. And so this is purely coming from my own experience and my sort of recollections and perspective on it when I reflect back. Uh, so yeah, we'll just get into it. Certainly you can ask questions throughout, or if there's time at the end as well. I'm completely open. I'm happy to answer any and all questions. Certainly happy to do that for you. So I knew I had cancer, and I was the first person to realize, and the reason I knew that is because I saw it on the technician's face when I went for an MRI, pardon me, a mammogram and an ultrasound following. So sort of the theme of my talk today is how when we're interacting with patients, their families, that kind of thing, how those interactions affect that patient. And certainly, although I would have been a physio for quite some time already, um, when you're hit with a diagnosis, you're the patient and nothing else really, is smart or is educated or ability to research and understand things that basically goes out the window and you just become that patient because you're taking everything in. So I was diagnosed in 2015, as Melissa said, and it was obviously a tough thing to take. But my mom was diagnosed in her 30s and died at the age of 45 from breast cancer. It was actually, she's diagnosed when I was in high school and she died 2 weeks before my physio grad. So my last year of physio was pretty tough, going home to visit her in Moose Jaw
Sorry,
throughout.
Nicole. I messed up. I was trying to get the camera so that you could actually see the students,
Oh,
and
okay.
I then cut you off completely. So I apologize for that.
No
I
worries
am
at
gonna
all.
see if we can. I'm less familiar with this camera than the one in the other room.
I know it's a bit tricky sometimes. It is nice to see faces if I can, but if not, that's okay too. Oh, there we go. There, that's better. Hi, guys. Nice to see some faces there. Awesome. I actually was crazy enough. We had our 30-year physio reunion this past summer, so I got to come and we got a personal tour of your space. So I got to see what it's all about, and wow, it's pretty phenomenal. Very, very fortunate.
Okay, so this will be probably as good as we're gonna get with my technical
No,
skills.
that's awesome. That's great. I'm not talking into space then. That's good.
Okay,
Um,
there we go.
okay.
Continue.
Okay, so yeah, so I was diagnosed in 2015, and yeah, my mom was diagnosed and died in her 40s at the same age I was. And so it was kind of one of those things just always waiting for it to happen. I hate to say, but um, I went to my doctor following the mammogram, and this was basically the sheet that she showed me. And that word malignancy at the bottom of the page, it just jumped off the page. That's the only word I saw. And, a tear kind of rolled down my cheek. And my doctor's, she just patted me on the knee and said, whatever you need, I'm here for you. And all I could think was, well, what am I going to need? Like, how bad is this going to get? So I went and sat in my car after, bawling my eyes out. And it's sort of one of those seminal moments in your life where you have your life up to that moment, that word hits you, and then your life is different from there on. It's not the same after. And so it's just a lot to process and take in. Um, so yeah, like I said, my mom was diagnosed as well. And basically, I remember in that car just thinking, that's not going to be me. I'm not going to have the same outcome as my mom had. And you have this inner strength that kind of comes over or seem to come over. Um, But it isn't really strange phenomenon in that you're still the same person, but you're also completely different. So, following that, it was sort of like when you'd run into people or meet up with folks you hadn't seen in a while, or relatives and friends, coworkers, and there's sort of this C word that's hanging between you, and they don't know, do they acknowledge it? Do they not? And it's sort of the onus is on you as the person with it to make other people feel more comfortable and it's okay to talk about. I used to get told a lot throughout my treatment, you're such an inspiration and you're so strong, but I didn't actually find that helpful because I didn't feel that way. I felt like I didn't really have a choice. You're just doing what you need to do to get through it. And when you're having those really, really hard days, you're kind of hanging by your fingernails some days, and it almost felt like an extra pressure. Like everyone thinks I'm strong, everyone thinks I'm this, and I'm not feeling that way. So it kind of felt like more of a pressure than a help. It was really, really hard telling my family and friends, of course, because you're trying to say, I'm going to be okay, everything's going to be fine, but you don't know. And you're trying not to freak them out as much as you're freaked out, even though everybody is. So it's just sort of this scared beyond words, all-encompassing type of feeling. And cancer really does take over every part of your life, every single aspect. Um, you're just living moment to moment. You're getting through the day. Sometimes you're getting through the moment. Um, there's endless appointments. There's so much information to take in, and you can't take it all in. Within those appointments, there's sort of every medical practitioner, literally from the receptionist at a desk, right through to an oncologist, a therapist. As you're trying to take the information in, you're just reading into every nuance, every tone. You're not almost hearing what they're saying, but you're reading their face, you're reading their body language, you're really listening to the tone of their voice. Um, so it's just those nonverbals are super important. So yeah, there was a biopsy. I went and I could see the lump on the screen in the radiologist's office, and there was no guessing. There it was. I could see it right there. So I had a referral to a surgeon, and the plan was to have a lumpectomy and a sentinel node biopsy. I had no idea what that was, and I can tell you it shows sort of the state of mind you're in. I went all through surgery, came out of surgery, still really didn't understand what had happened to me. Like you can't take it in. It's just a common theme. I found that oftentimes with patients after the fact or when you're working with them, like, why aren't they getting what I'm trying to tell them? Well, because they can't take it in. It's just too much information. So, the day before surgery, I had to go and have nuclear dye injected into my breast, four needles. And so they use those tracer dyes to see where those lymph nodes are, and they prep you for surgery in that way. And I also had a guide wire put in so they could see exactly and pinpoint where that lump was. So for me, my lump was very high up on my chest wall, almost under my clavicle. So it wasn't actually really truly in my breast, or sorry, more in the arm axilla area, but the breast tissue goes up to your clavicle. So it was a different kind of a place and kind of tucked under a rib. So I was told I would have never found it myself before it would have been probably too late. So the OR report came through. There's a sort of picture of lymph nodes. And so what they did eventually is I have one incision kind of up under my axilla area in the front. They went in one direction and got the lump out, and they went in the other direction, and 5 lymph nodes were removed. So typically a sentinel node biopsy, they take about 2 nodes out, but the surgeon said they were being very, very careful and making sure they got everything, quote unquote. So those lymph nodes were assessed and everything, and there was nothing in the lymph node, nothing spread there. So you'll see where I'm getting to is the surgery causes a fair amount of trauma. So in my mind, I thought a lumpectomy is they go in, they pluck this lump out, we're good to go. Not the case for me at all. So because of where my lump was and getting into the tissue, there was a lot of trauma to that area. So they're cutting through muscle, fascia, nerve. Um, and I still to this day, basically from my armpit to my elbow on the backside, it's still numb. So those the nerve was snipped during surgery. They had to get to the lump. Um, so it's a lot more involved than just taking that out. So I was discharged home that night. I'm throwing up, feeling really rough. So the pathology report came through, and basically what it's telling me is that there was one small lump that they took out. It was a stage 1, meaning it was quite small, but grade 2, meaning the cancer cells themselves were quite aggressive, partly due to my age. I was younger, that kind of thing. And the type of cancer, it was also estrogen receptive. So estrogen was feeding those cancer cells. So here's just another sort of report here. So estrogen positive at the bottom, kind of in the middle, you can see there was ductal carcinoma, but no evidence of malignancy in the lymph nodes. And they took out 1 to 5 nodes were taken out. So by day 3 post-surgery, and I think you folks do take lymphedema in school. There was nothing about it when I went to school, so I knew nothing about it until it happened to me. So by day 3 post-surgery, I could feel kind of this tightened kind of a cord underneath my arm, sort of starting from here. And every day it was getting kind of farther down my arm. It kind of almost felt like a guitar string. It was really tight and a defined cord in there. And so by day 5, it's like past my elbow, and I'm having trouble straightening my elbow. Um, kept going, and eventually I could feel it all the way down, traveled all the way down my arm into my thumb. So fortunately enough, I was able to get into the lymphedema clinic at the Pasqua Hospital at the time, is where it was. And the physio's named Tracy. I actually met her years ago when I was in physio school, and she was trying to get in. So here we were like 25 years later. Now she's my physio. And she explained that I had axillary Webb syndrome, otherwise known as cording. So you can see there, those green vessels there are your lymph vessels and the nodes. So we started treatment, and basically what's happened is they take those lymph nodes out and removed, but the vessel's still there, and there's fluid in there, and it has nowhere to go. So those vessels start adhering down and sticking down, and so that's the cord. It's sticking down, and there's nowhere for that fluid to go. So with really gentle treatment, literally during the treatment, you could hear pop, pop, pop as the vessel was releasing and letting go inside my arm. So as the summer progressed on, I went through treatment and it was starting to feel, my arm was starting to feel somewhat more normal, was feeling better. So that's the piece of the lymphedema starting. The next piece was the actual treatment of the cancer. So I'd already had the surgery, I had my first appointment at the cancer clinic with the oncologist. And I get into the appointment and he starts talking about chemo. And I get quite teary and he says, why are you upset? And I said, well, I wasn't prepared to hear that word today. No one had talked to me about it. And he said, well, um, basically in that moment, I had to decide, would I take chemo or would I not going forward? And if I would, they would send a test away to California called oncotype testing. And what that does is it analyzes the cancer cells and it determines your risk of recurrence within 10 years. So, yes, of course, I'll get the test. So I waited about 6 weeks for it to come back, go back to the cancer clinic thinking all or none. So he says if I have low rate of recurrence or low risk, I don't need chemo. If I have high risk, I need it. And there was a huge, massive study going on about intermediate risk and whether you would need chemo or not. So I went to the appointment thinking I'm going to have it or I'm not. It's one or the other. So I'm preparing myself mentally for this. Get to the appointment, and my numbers, if you see it coming across and dropping down to the 20 at the bottom, so you can see the 20 is just over the line into intermediate risk. It's sitting in the middle there. So guess what? There's no definitive answer. So here I am, one of those hanging by the fingernail moments where he says, well, you have to make a decision today. I was there by myself. I'm telling you, did I read every nonverbal that he could give me? I asked him what he would do. I asked him, every kind of way of, and basically he just said the study's not back, there's no definitive answer. He just kept kind of saying that. So I listened to my gut. I read his nonverbals, and there's something inside me that told me I didn't need chemo. So I chose not to take it. And going forward from there, I probably told about 4 or 5 people, my immediate family, that was the outcome and that what was happening. Everyone else in my life that would ask, I would just say, oh, I didn't need chemo. I didn't need chemo because I just didn't want people's opinions and thoughts around it to influence how I sort of felt about it. So yeah, it was a life-changing decision I made literally in the moment. And sure as heck, about 2 years later, um, the study came out, and women that fall in that intermediate range can safely skip chemo. So this came out in the news, as you can see. And so I had actually made the right decision, but yeah, you're kind of hanging on pins and needles for sure. So in the midst of all that, the next stage was radiation. So once I knew that I wasn't going to do the chemo route, radiation was the next route. So I have 8 permanent tattoo marks on my upper torso that are the markers. So I still have them. Those are the markers that show where they're going to line you up for radiation. So radiation was super traumatic for me. Some people, you hear, oh yeah, I went from radiation. I'm still working the whole thing. That was not my experience at all. So partly it was traumatic because I remember taking my own mom to the same place and helping her get on the radiation table when I was, in university age. And now I was the one doing it. And so you go and you wait, and there's these signs everywhere as you're waiting. It's in the basement, the bowels of the hospital, because it's so dangerous. And there's signs everywhere saying danger, radiation in progress, and they're shooting that into my chest. So it's just hard to kind of wrap your head around it. So I would have to go, topless during the treatment, put your hands up over some bars behind, and they would just line you up perfectly every single time. And the techs would kind of jostle you a little bit, and they'd look at each other over top of me and say, "Are you happy?" "Yep, yep, she looks good. I'm happy." And I'd be laying there going, "I am not happy." So some days, I'd be okay and I would just lay there calmly. Other days I'd be a little bit tearful, and other days the tears are just rolling back into my ears and I'm trying to hold it together. Um, Certainly you have to stay still. They told me at one point they miss your heart by 2 millimeters or something like that. Like it's really crazy. I thought in my mind they're just radiating the one spot, but no, they're radiating your whole upper quadrant. So it's it's basically burning you through. So the treatment I had 21 doses over 5 weeks. And I thought to myself, often a typical treatment dose at the time was 25 treatments. And I thought, oh, less must be better. But no, less was more. So they were trialing something where they were alternating between one treatment would be higher dosage, the next day lower, higher dosage, lower. And so they're trying to, hit you harder in a shorter amount of time. The effects of radiation are cumulative, so every day it's just accumulating and accumulating. And so I started out a little bit pink and a little bit pink, and then I was fire engine red. And then I still had about a week to go. The whole team came in, oncologists, they're like, your skin is completely breaking down. You can stop if you need to. And I'm like, well, no, this is the treatment you've prescribed. I'll stick it out to the end. In retrospect, maybe I should have stopped, but I basically had a big open sore right over the area. The whole under part of my fold under my breast was completely open and raw. Um, the last week they did these booster shots that even upped the dosage higher. So I basically, and then it lasts for several weeks after you're finished. It just keeps accumulating. It takes about 2, 3 weeks till it finally starts settling. So for about a solid month at home, I just wore kind of a robe open on my back and I was treating it, cold salt compresses and polysporin to try and keep it from getting infected. So I used to, I dress it to get to the hospital to have my treatment, come home and just open to air again. So it was tough. Like you're going to the hospital, run into people that you know, and you look great on the outside and you're a total mess on the inside. So people just, they don't realize. So, um, yeah, it was kind of wild. Like, so it's a real surreal experience because you're laying on this slab and then they got music playing. You got like Fleetwood Mac and Aerosmith and all this stuff, and you're laying there trying to take it in. So anyway, yeah. So I had radiation was a really tough go. When you think through radiation, it's not just burning, although my skin was all burnt, it's burning through muscle, ligaments, blood vessels, nerve. Just like all the tissues on the inside are getting that same treatment. So it just sort of speaks to how invasive cancer is. Obviously this tiny, tiny little lump, and they just, they hit you with a tsunami kind of thing. So here's a picture of what I looked partway through. Sorry for the visual, but it gives you an idea of what was kind of happening. So the lymphedema changes the DNA or the radiation, it changes those DNA cells for life. So basically, going forward, the rest of my life, that radiated tissue has kind of a low-grade inflammation, and there's no elasticity to that tissue. So there's kind of this fine balance of that lymph load because I don't have lymph nodes there. So, the tissues can trap that fluid sort of going forward. So you can see here, picture of the lymph system. It doesn't end at your wrist. It goes all the way into your hand, obviously. Um, so for me, following, I had what was called major radiation fibrosis. And basically that cording came back with a vengeance after radiation. So it ended up at its worst point. You can see all those lymph vessels through the breast. So I literally had a web. You could look at my breast and you'd see all the vessels just sticking out. So I had a web through my breast, all the way down my arm to the thumb. And then you can see the ones through the trunk. I also had lymph vessels you could see going all the way down to my hip. So that whole left side of my body, upper body, was affected and full-on lymphedema from that. So I could feel it started out my arm getting heavier and achy. And so when I went back to see Tracy, she's like, "You have lymphedema." So my first day, she fit me with a compression sleeve as a start. And it was hot and it was tight. And I was like, oh God. So another lot of crying in my car, let's put it that way for that year. But it was like, I just felt like this is me now kind of thing, something else to manage and deal with. So for me, my main issue was a blockage issue. So with lymphedema, either you have blockage or drainage. So I had more of a blockage because the tissue was so stuck down and fibrosed around that area. So it was blocked right here. So the arm would get stuck, the breast would get stuck, and we had to find ways to drain that. So at its worst, I was going for physio 4 times a week to try and get this under control. Try and get the fluid moving, get the tissues to settle, but just everything was just so inflamed. So with the lymph system, this one kind of is a skip ahead, but so here's sort of what I know. You could have 30 lymph nodes in that area, and I might only have 10. So everybody's different. We have different amount. Um, Not all lymph nodes or lymph vessels are as important as the others. So some act kind of like a back alley or a side street, and some are like the Trans-Canada, and they lots of fluid moves through them. I feel like I might have had the Trans-Canada removed because it was so affected. Um, it affects about 20% of breast cancer post-surgical folks, and they don't always know why. I mean, there's tons of research coming out for sure, but it can affect folks right away, like it did me. Third day after surgery, things were happening, or it may not affect folks for years later. Is there a genetic component? Maybe. They don't know for sure. And fluid will increase in my limb by 30% before it's actually visual. So that's why I can feel my arms getting heavy, it's getting achy, but it doesn't really look any different because it's increasing as we go. And that fluid, everybody may know this already, but the fluid is interstitial. So it's between every cell. You can't just go in and drain it out. They say, well, why can't you just let that go? Well, you can't because it's in between every little cell, every little place in that area. So lymphedema is an accumulation of a protein-rich fluid in those soft tissues, and it interrupts lymphatic flow and causes swelling in that affected limb. And for me, actually, my breast was more of an issue than my arm. So a lot of women, they'll go to the doctor after, and the doctor will say, well, you have mastitis, you have a breast infection. Well, that's not it at all. You actually have lymphedema. So it's just not that commonly known. So here's an example of course, this is not me, this is just an example. Um, so stage one, now I'm probably sitting between a stage one, stage two, but there was a time when I was at stage two. And boy, you start freaking out because it can keep progressing. And if you don't get a handle on it, it'll keep going from there. So the stages, basically that lymph system is the workhorse of the body and it transfers immune cells, cancer cells, infection, colds, cuts. It rids the body of these cells and it takes it into the vascular system and then we pee it out. So that's how we get rid of it. And there's a thing called the lymph load. So when people are healthy and they have a normal lymph system, they might have quite a lot of, they're here and then they get a cold or infection and their lymph node goes up a bit and then they get over it and it comes back down again. So what happens with lymphedema is that lymph load gets less and less and less, and then you're riding the line of even. And then when you're actually in lymphedema, you're above and you can't get rid of that fluid. So sort of that stage two, I was always riding the line kind of here, right around the hair, right around. Then by stage two, you're up and over, and then you just go from there and you can't get it back down. So lymphedema is extremely resistant to treatment, causes chronic infections. It can lead to hardening of the skin, can distort your limb, and it can cause full body sepsis with infections and even death. So it seems like, what's the big deal? Your arm swells. Well, it can cause some major systemic issues. So you can see as that person on the far right, how her arm and hand is really quite puffy if you look comparison to her other hand. So they do circumferential measurements for compression and coverage. Thank goodness, lymph garments in Saskatchewan are covered. So super grateful because if you live on most parts of the world and even Canada, that's not covered and it's very expensive. So the treatment's extremely complex. I was in active lymphedema treatment for minimum 3 years after my surgery. I still have maintenance ongoing and I still have flare-ups. So 6, 8 months ago, I was starting to go into another flare-up. And so back to treatment, I was able to get in and remeasured for garments. Away we go again, lots of treatment and get it back settled down again. So it was kind of a wake-up call because my therapist said, you might think you're good, but that radiation, it kind of hit it home to me again, that radiated tissue continues to be inflamed and sort of it continues to accumulate your whole life. So you just always have to stay on top of it. So that's not my hand, but that certainly is an example of how, bad it can get. Basically, over those 3-year period, I would go into these flare-ups. They'd last maybe 3 to 6 months, get really panicky. Am I going to get to that next stage and not come back down? Am I going to become a stage 3 and not get back down? So for me, I had compression garments. So the vest is, those things are made down in South Carolina at the time they were. So they look homemade because they kind of are, but they're made through Jost and made to measure, made to suit you. I also wore a sleeve and a hand gauntlet. I never had to wear a full glove, but I did have to wear that gauntlet for quite some time. And then these were my nighttime garments. So the upper body was kind of like this tube top thing that was a two-layered. So um, during the day, the compression garments just keep you from getting bigger, from expanding the fluid. The night garments actually help you drain. So the one around the breast area has these grooves and sewn in areas to it that help as you're sleeping and moving. And the compression band over the top, it helps fluid move and drain. The arm one at night, the picture on that bottom left, that's actually my skin. So that's what it would look like in the morning. And that sleeve, I actually quite liked wearing it. It seems weird. It was comfortable. My arm just felt supported and you could feel almost that draining sensation there. You see on my left side, that incision doesn't look very big. That's my incision. It's not huge, but it did cause a lot of issues. Another treatment for me was self-lymphatic drainage. So I learned how to do that. Um, the one other thing about the garments is, yeah, the one on the nighttime sleeve was actually made in Germany. Everything's made to measure. They measure you exactly. It's made to fit only you. So about 70% of that lymph system's under your skin. So that's why those garments, by that little bit of movement or pressure, they help to do the draining. So for at least 2 to 3 years, I was totally compressed 24 hours of the day. I only did not have compression garments on when I was in the shower. I'd get out of the shower, I'd put them right back on. I'd get ready for bed, I'd put the stuff on at night. So constantly wearing garments. Summer is a bugger. It is so hot. They don't breathe. Heat's one of the worst things for lymphedema, but you need to wear this stuff to help with the compression. So it's kind of this constant sort of battle. I also had kinesiotaping. This was done for about 6 months. So the big thick tape is actually following the cord that was always sticking out. The other finger tapes are basically showing they pull along the fluid with how the lymph system goes. So there's not all the pictures there, but it's basically I had them coming all the way up my arm and then the tape pulled right across. I had fingers, about 6 to 8 fingers across my breasts, and it's all pulling the fluid over to my healthy side so then it could go out and drain and I could pee it out. So these I would have to reapply every about 3 days, 4 days. Got really good at doing it myself or family members helping. But the kinesiotaping, I wore that quite a bit too. I also was on the lymph pump. So when I would be in a flare up, I'd be back at the Pascoa Hospital and be on there for upwards of an hour at a time. It's quite relaxing actually. So this big sleeve, it pumps all the way, and then the part around the trunk area, it pumps the front and the back of you. And so you're on this thing and you like race to the bathroom after to have a pee because that's all that fluid is coming out of you. I also did sort of gentle mobilizations that were part of therapy, and then also really heavy tissue work to get that tissue unstuck. So I would leave therapy and I would feel like a truck ran over me. I'd just be exhausted. It was really heavy work. It's all was stuck down to my rib cage, stuck down to my chest. So there was a lot of heavy work to be done. Um, During treatment, you could literally see my breast go down in size. It was unreal. Physio works. It was amazing. So you could literally see it go whoop as the fluid was being drained. It was quite phenomenal. I also did pool therapy, a specific program for lymphedema. There'd be these 48 positions that we do in the water, and it would help. Same thing, you're racing to the bathroom after or even during the session. I did a home stretch and strengthening program. I did that thing for 45 minutes twice a day, every day when I was in the thick of it. So I did that a good solid 2 years just to keep that moving, keep that tissue stretching. Another big thing is deep breathing because your main lymph vessels pierce through the diaphragm. So by the deep breathing, it helps pump that fluid. Reducing stress is a huge one. Increasing stress is a huge thing towards having a flare up. Then the flare up increases your stress and it's a vicious cycle. So that was another piece, sort of meditation, calming type stuff. I have to prevent any injury to that side of my body. So I don't do any injections. So I can't do blood work. I don't do blood pressure on that arm. No hangnails, no cuts, watching when I do yard work, pet scratches, anything. So treating any kind of a little nick on a finger, you got to treat it right away. I got a bug bite on my arm a few years ago, and it kind of kept getting a bit bigger. And when I went in, I happened to have physio a couple days later, and they said next time that happens, you go straight to emergent, you get put on antibiotics right away because that sepsis can be kick in so quickly. So this is my pink band. Whenever I have had to go into the hospital for anything, I wear it on that side, and the nurses, they put stuff above my bed, that kind of thing, to say don't use that arm for anything. I can't risk it having any injury to it to put me on the next stage for lymphedema. So yeah, heat's the worst thing. Weight gain, so that's actually been a struggle of mine, I will admit. Estrogen is produced by fat cells, and because estrogen fed my cancer, I try and keep my estrogen level down. So there's certain things, phytoestrogens you should avoid eating, like flax and soy, things like that, raspberries. It's kind of weird. Um, so yeah, basically travel, airplanes, I often wear that night sleeve because the pressure on the airplane causes swelling. So a flare-up is kind of a cascade of events. Things start happening and they go down this path. So your constant interventions, constant management. I got out of my compression stuff about 3, 4 years ago. I was freaked out, but my physio was like, no, let's start trying it. And so now it's more an as needed, which I never dreamt. I thought I'd be in that stuff for life. So it goes to show it takes that long, 5, 8 years for your body to kind of adapt and get used to it and learn how to manage that area and kind of work around it with all the treatment that you're doing. So for me, I have this lifelong condition, and it's not due to cancer, but it's due to the treatment. So it's hard to wrap your head around that at the beginning. It's just like, for God's sakes, I got this thing on top of the fear of the cancer. So it's just really a good reminder to realize how destructive cancer is because of how hard they hit you with the treatment. That little tiny lump I said. So I went to a lymph symposium quite a few years back. There were folks from Stanford, Harvard, sort of latest research, and three options they were looking at, and I've seen this is actually starting to actually happen now, are lymph node transplants, where they might actually transplant a node from your groin up to your armpit area. Um, Also a thing called biobridging. Well, I've got the vessel that's not attached anymore. So they might do a little bridge between to that vessel to back into the main lymph area. And also they're looking at some type of a pill, an anti-inflammatory pill, which is just mind-blowing. So might happen in my lifetime yet. So another big piece of it was I chose to go ahead and do genetic testing because my mom was diagnosed so young and died so young. But there's major implications for your whole entire family. Some people don't want to know. Some people do want to know. So, it's just something that sort of as you're going forward. So the genetic testing was out of Saskatoon, and I had to fill out a major biography thing ahead of time, and I had 28 family members to include. So basically, they were saying it's not looking good. Well, lo and behold, I get the call at work. I had to wait quite some time. It was at least 2 year wait to even get the testing done. So they checked me for genetic markers for breast, ovarian, and colon cancer, and they all came back negative. So I got the phone call at work. I just lost it. It was like such a huge relief. I've got two little boys at the time. You could be passing that on to your sons for different types of cancers. So that was a huge relief for me. I was very much preparing to have a full mastectomy and ovaries out and the whole thing. And so that was something, you're carrying these things with you. People don't realize you're dealing with. Another piece, this was in the fall after my diagnosis, and the Run for the Cure was coming up. And I said, these are my sisters. And I said, I want to do it. I want to do the Run for the Cure. no big fanfare. I just, no matter what state I'm in, I want to do that. So this was after um, radiation was complete, and I haven't have a ton of energy, but we went for it. And the one sister was like, I think we should have a team and we just need 10 people. And I'm like, okay. So I hadn't been like super open. I mean, I'd been open about it, but I hadn't been super public about it, I guess is the way. So she's like, no, I think we should open this up and, we could make a difference. So we ended up having over 80 people on this team. We had people also from other provinces that joined in, family and friends, and we raised over $10,000. So it was just crazy, super humbling and obviously emotional. I'm getting teary thinking about it. Experience. So the Little Rough Rider fans, those are my boys at the time. They were in kindergarten when all this was going on. So there was a lot happening. So just a few pictures from the day. It was a big deal. That was the name of our team, Bless His Chest. So a friend had come up with it. Then these are little thank you cards that my boys made that we sent out after. And then we haven't done it for a year or two, but we usually try and do the Run for the Cure yearly since then, and the boys have done through school and that kind of thing too. So another experience or opportunity that came along was Tracy, the physio, was lobbying with and working with Sask Health Authority 811 regarding a pilot to screen for lymphedema post breast cancer. So she said, "I want you to come and be my personal story." And I'm like, "Okay." So got myself put together and went to do this. And basically, we did this presentation, and there were like Ministry of Health, 811, um, cancer agency, all these folks all around a boardroom. And I basically tell my story very briefly in about 10 minutes, and you could have heard a pin drop. And I think part of it was a room full of women, and they all were like, that could be me sitting there. We were about the same age, we were similar, professionals, that kind of thing. And so they asked me a lot of things, what would have helped, what are things that would have. So I made suggestions around it. And lo and behold, they literally took my suggestions and they implemented it into this program. And so at the time, it was anyone in southern Saskatchewan that had breast cancer surgery was going to get a phone call and follow up to screen them and see how things are going. So this was about 8 months later. I was invited to come do a media release with the Minister of Health and a bunch of other bigwigs. And on the other side of me here is this total massive media scrum. And so I had to stand up and did my same thing, very brief statement and story. And I got asked a lot of questions. And it was just a really amazing experience to give back to women coming after me, where you just share your story. Another piece that came from this is these are all breast cancer survivors. And actually, the gal on the far right is Tracy, our physio. And we had never known each other before, but Sangeeta in the middle, we kind of got to know each other through the curtain at physio, and she had some similar experiences that I did. And we went out one night for a visit, and she talked about this high tea of hope that was coming up that Tracy organizes at the Hotel Sask. And Sangeeta on the side has sort of a Bollywood dance company. And so the next thing you know, we came up with the idea we're going to dance at this thing. And I'm telling you what an experience. So we did this for two or 3 years in a row, and we had custom made saris that came from India for us. And Sangeeta choreographed this beautiful dance of getting a diagnosis, coping with it, being surrounded by your peers, your females, your support, and coming out stronger and sort of victorious from it. So these are just some of the photos from our performance. And I bet you there's 350 people at this thing. Never would have done this in a million years. And yeah, we were like, we should take our show on the road. We used to kind of joke about it. So anyway, there's just something to for people that like most things in life, when you've been through it, similar experiences, you just get each other like nobody else does. So this is outside the Pasco Hospital, and those are my boys. And you know what? You just cope and you do what you need to do. So they would come to appointments with me, and it's amazing what becomes normal and what they get used to. They had some kind of funny comments over time when we did the Run for the Cure. Graham, the one time, say, are we? He came home talking about Terry Fox, and I said, well, we're gonna go around Wascana Lake. That's what we're gonna do for funding. And so it was just kind of interesting his take on it. And another time, probably about 2 years after, he said to me the one night, Mom, do you still have cancer? And I said, no, I don't. And he goes, do you have to wear that sleeve? And at the time I said, yeah, I'm probably always going to have to wear the sleeve. And he says, well, could you climb a mountain? Which I thought was kind of odd, but I'm like, yeah, I guess I could. And he said, okay, you're all right then. You're good. So it's just, funny kids take on things that things are, you're fine, you're good. So what do you do for going forward? Well, I guess you get a dog. You get a dog. Our dog's so cute. I had to put a slide of them. That's Jade. Um, it's interesting. People have asked me a lot over the years, what was helpful? What was a good thing? My sister-in-law just got diagnosed. What could I do? And I usually just say to people, just help. So often folks say, what can I do to help? Just help. Um, it's really tough to ask for help. You're overwhelmed. You don't know what you need. You don't know what you want. Um, and it's really hard to ask for help. So just help. Pick their kids up for a play date, do some laundry, drop off some groceries, drop up a coffee, whatever. Just do something if you feel at a loss, because it almost feels like you're putting that when you're on the receiving end of it, it feels like the onus is on me. I don't know. I don't know how to ask. I don't know what I need. It's an extra pressure on me. So instead of saying, what can I do? Just do it. Do something. And it's so, so appreciated. There are some things told to me during my experience that I didn't find helpful. You'd think they would be, but they weren't. They're kind of hard when you're on the other side of it. And I'll give you some perspective on it. So I would have people say to me, oh, you're lucky you only had radiation or you only had a lumpectomy. So for one, they don't know what I went through or what my experience was. Like I said, I look fine on the outside. I didn't lose my hair. I still put makeup on. I still got dressed and did my thing, but I was really struggling. And so it kind of also negates what did happen to me and what I did go through. So yes, there's no luck involved in it. And there's also kind of a guilt. I felt a sense of guilt in a lot of women did have a lot tougher go of it than I did. And so you're kind of caught in this middle of like, you don't want to complain and say I had all these other things happen, but on the other hand, folks that had a lot tougher go. So it's just this weird kind of vibe of like trying to explain that. And I also got a lot of, are you back to work yet? So because it's in the hospital, I knew lots of people I'd run into. Of course, it's coming from a place of kindness and love, and like, I hope you're on the mend and it's going okay. But on the receiving end of it, I felt like I always had to justify why I wasn't at work yet. And so I was off work for almost a year and constantly treatments. And there's no way, like the radiation fatigue fog, I had twin babies. Like, I don't know what tired was, but this was a whole other piece of it. And so that fog lasted 3, 6 months, that alone. So it's just kind of being aware, being cognizant of that, I guess, is something just to take away from it. Um, so my advice when people would ask me, I'd say just keep it simple. Just like, how's treatment going? I've been thinking about you, and then basically just listen, is probably your best bet if people want to share. I didn't have problems sharing, but also you kind of get tired of talking and thinking about it too. So, but yeah, just keep it simple is probably the best. I found the experience to be extremely lonely. And I'll give you the caveat of that is that I had the most amazing support. I had love and support to the nth degree. However, no one can do it for you. You have to do it on your own. So you can't be, you know what, I got to take a day off today and my sister or my friend's going to go for me. You got to go and you got to show up every single day, no matter how this is, and whether that's showing up at appointments or just in your life. Um, so it's really, I found it really lonely because there's no one here to do this with me or for me. It's really just me. So that, and plus the fear is basically eating you up alive. So you're trying to cope with the fear of it coming back, the fear of it, what's going to happen. So, PTSD and breast cancer is quite well researched and it's absolutely a real thing. And I had other people say to me, the hard part's actually when it's over. And I would completely agree with that. You're hanging on and it's tough as nails going through it, but it's after it's all done and you look around and nothing in your life looks or feels the same. I don't know what I'm going to do going forward. I don't know what that looks like. Work's different, home's different, relationships are different, friend interactions are, it's just different, everything. And that lymphedema piece, I'm a bit of a stubborn, all or none, get it done person, and you can't do that with lymphedema at all. So that really taught me, like if I'm going to do yard work, I'm going to do it all darn day. Well, you can't do that. So there was a lot of things to learn about yourself and how to get through. And also, there's kind of when you're in treatment, there's kind of a sense of security because everyone's looking out for you. You're going to all these experts, they know what they're doing. They tell you what to do, you do it. All of a sudden, that's all gone, and it's up to you to kind of figure that piece out. So that was hard. And also, everyone around me, I got discharged from the cancer clinic a year or two after, kind of thing, and everyone's celebrating and you kick cancer's ass and way to go and all that. But I didn't feel that at all. I felt like, why did this even happen to me? Why did I have to go through this? You're questioning that kind of a piece to it. When I would go to the cancer clinic, you'd be sitting in the waiting room and, you're looking around and I'd be like, I don't belong here. These aren't my people. I'm not like these people. And then you have this really humbling to your knee moment of like, I do belong here and I am like these people and I am one of these people. So you just have a lot to kind of manage. How do I manage? How do I get my life back? How do I cope with the fear of it coming back? So those are a lot of the pieces. So the things that I do are surveillance MRI and mammograms every 6 months. I was on tamoxifen for 5 years and then I'm off of it. And the tamoxifen binds to estrogen, so it can't feed cancer if it's there. So I'm off that now. Nutrition, trying to eat organic, healthy, keep the toxins at bay as best you can without driving yourself crazy. Exercise, movement, like I said, meditation, get outside. Counseling was a big piece for me too. I am a firm believer this was not purely physical. There's more to this for me. Um, and then just kind of seeing the humor in life, being expressive, that kind of bit too. Getting back to things. So I cracked up because I'm like, look at this. Here's the riders again. So that's good. Good weekend. So yeah, just getting back into life again is really what it is. And things, they kind of do turn out better than you think they're going to. So what lies ahead? And so to kind of bring this back around to the patient experience. So I was off work, like I said, almost a year. I come back to work. I work in adult neuro at Wascana Rehab at the time. I'm the senior physio. everyone looks to me. I love leading, I love teaching, I love mentoring, and I've been gutted by this experience. So I come back. Now I'm wearing all this compression stuff. I got patients saying, geez, you look like you need treatment. Like it was just the whole thing. So little by little, you get your momentum back, you get yourself back, you get your confidence back. Um, I found that I was a better therapist because I was much more understanding of what it felt like to sit on the other side of that plinth and be on the plinth and not looking at the person on it. Um, and I understood how when I explained things, giving them time to process, helping them understand, not just throwing information at, I was always very conscientious, but it was even more so. So, understanding you're coming out. I worked in the big treatment area. I've never worked private. I've always worked in that public system, but you're in this big treatment area. That patient, their family, they're scared spitless sitting there. They don't know what's coming. And working in neuro, I was working with people that were never going to be the same like I was. So, their strokes, their head injuries, their quads, their all this kind of stuff. So we're not just dealing with a sprained ankle kind of thing. Like these are major life events. And having the realization everybody's grieving. They're grieving their old life, their socioeconomic status, their status within a family, their work, their friendships, that kind of thing. Um, and sort of having more empathy and I guess maybe understanding for that. Um, I used to always say kind of to students, and maybe I shouldn't have, but the physio part doesn't really matter so much because we can all learn that. We can learn stuff. It's how you treat your patients, how you make eye contact, how you listen, how you interact. Those are the things that are going to get you your best results because you're going to make that connection with them. Okay. So that old wood sign that's been hanging in the therapy department there since before I started. So it was just kind of always a reminder, and I always meant a bit to me as well. So it's kind of true. So yeah, on the left, we have all our techniques, right? We got our therapy techniques. That's what you guys are all learning. You're taking that in, but just never forget the perspective of the patient and also the fact that they're coming to you with this whole hit, I would show up in therapy, but they didn't know, oh God, I got two kids that are at home and I've got like all these other responsibilities, but I'm showing up trying to hold it together and take in information. So, just kind of everybody's got their story. We all do. We all have things that we're bringing with us when we come to work and therapy, but sort of what's our biggest impact that way. Okay. Um, And just that piece of the patients being overwhelmed, their nervous system's on high alert, they're taking lots of information in. So just making that connection with them. Um, I used to always on my initial assessments, you'd see that patient across the treatment area. Yeah, I got to get through all my stuff. I got to get my assessment complete. But I wanted them to leave there feeling and thinking I'm in good hands. She knows what she's doing. It's going to be okay. And you could just see that as the assessment went on and from the beginning to the end, they would just like bring it down a notch, if they're cognitively able to. And just like, okay, this is going to be okay. Not just buying into what I'm giving them, but also engaging and being able to make that connection. So this is I kind of forgot to mention at the beginning. So I just had finished radiation and the Regina Marathon was going on, and I'd ran a little bit in it before, but more relay kind of stuff. And my friend picked me up and we went and watched, and I was winded literally walking from the car. And I'm sitting on this bench, and people kind of were running past and they saw me and they were hugging me. They hadn't seen me since all this stuff. And I was sitting there going, damn it, I'm gonna run this thing next year. I don't care what's at. So sure as heck, a year later, here I did. I ran the half marathon. I'm reaching out, that's my sister's hand I'm reaching out to there. And it was just this culmination of like all the shit I'd been through all year. And there I was. I'd done it. I didn't care what time I got. I high-fived every kid, every grandpa. I was so like excited and happy to be there. And I crossed that finish line and I just kind of dropped to my head on my knees and had a big cry because it was just such a kind of a release of it. So it was a big sort of accomplishment. So those are my boys now. They are over 6 feet tall in grade 11. And yeah, we've kind of gone through a lot of stuff as all families and everyone does, but just as you kind of it's amazing kind of what you get through and what sort of becomes normalized. So yeah, so that's the end of my presentation. Um, I'll try and am I still sharing or are you okay now?
Yeah, you can, if you want to just stop sharing
Oh,
your
stop
screen,
sharing
that's
the
fine.
bottom. Thank you. There you go,
Yeah,
Jade at the bottom again. There we go.
there.
So,
Okay,
yeah,
so
thank you so
thank you very
much.
much, Nicole. That was a great presentation. Do we have any questions from the students? I can relay those. They'll have to use the mic to ask them, but do we have any questions from the students? Okay, we've
Ask
got
some,
one.
guys. Ask me some good stuff. Doesn't have to be this, it can be anything related. I'm happy to answer anything other too.
I guess my question is, do you think knowing more as a physio, how do you think that impacted, first finding out the diagnosis and then your treatment? Does knowing more make it better or worse?
I think knowing more makes it better, to be honest. That's maybe just my personality and and I don't know, as physios, we're artists and scientists all in one because we want the research and the science behind it. So I found practitioners would kind of tell me more because they would find out I'm a physio and then I would understand maybe physiologically what's happening and understand the process more. Um, so I like having that information, good, bad, or otherwise. But I will say there were times like my physio sort of once I was into the radiation and the one day she says, do you really want to know what happens to those tissues and stuff? And I said, yeah, I do. And I found it was almost too much. I was like, holy crap, what's going to happen here? And, she gave me some real specific and vivid visuals and photos. And so in that instance, I almost felt like I wasn't quite ready for it. But in retrospect, no, I'd rather know more than not know, and kind of be prepared that way. But yeah, that's a really good question. Might depend on your personality too, but
Okay, great. Anyone else have any questions? Hey, we got another one here.
Kind of in reference to our little topic worksheet that we had, that we could kind of take notes based on what you shared. There was a section on informed consent. And just as you talked about your experience with how maybe the experience was different than what you expected, or like with radiation, it would be the whole upper quadrant, not just the one area. Do you think that there could be changes in the way that they received informed consent from you, in terms of knowing what to expect, understand like the dosage amounts, like you said, you thought lower was actually lower and higher was higher, and it wasn't until after, or even knowing like, yeah, what was going to happen and maybe some treatment that could help those symptoms that came up throughout your treatment. Kind of adding on to that too, and I know I'm asking more than just one, but I feel like you can put it all together, is with them asking if you want to stop or keep going when you did have the open wounds. Did you feel like that was the correct time for them to ask that type of question due to the emotional toll that you would have had, probably still being fearful that the cancer could return or it isn't fully gone? Yeah, did that feel like the right time, I guess, to ask, like, hey, do you want to continue radiation? When, of course, you do if that's the goal, right? But, like, of course, you don't either because of what you're experiencing. So I was just curious about those 2 points in terms of informed consent.
that's, I've never been asked that before. That's a great, I hadn't thought of it that way. I think there's a double-edged sword to it. I didn't tell you guys this piece, but my surgeon was actually in the physio class ahead of me, and then she became a surgeon. So I think that piece of it too. And so it just happened to be that way. I think she thought I understood better than I did, because I think she thought, well, she would sort of, and in the moment, you can't really take all that information in. So I think, to be honest, my informed consent could have been better now that I think about it. There was not really anything really in writing or that I recall. Like, yeah, I'm signing off. Yeah, I'm having this surgery, and if they find this, they can do that and that. But I didn't kind of have the capacity to ask enough questions, and also I maybe might have felt, well, I should know this stuff. Like, I'm a medical person, but I just didn't understand it because of the overwhelm. So I think the informed consent could have been better, actually. I mean, this was 10 years ago now already, which is hard to think. I would think it's probably better now. Um, and then the radiation piece also, like, it's really interesting because since then, I've met some women who were choosing not to have radiation because they know how bad it can be and some of the after effects. So you wouldn't think there's as much personal choice in it as there is, but there is a bit there, I must say. People can choose to do as much treatment or maybe less treatment than they want. But yeah, I don't know if I'm answering it the best, but definitely that radiation piece, you're super vulnerable, you're kind of a mess. And I was also really stubborn about kind of partly I felt lonely, but I also felt stubborn to do it on my own too. Like I didn't always bring family or friends with me to appointments, and I certainly probably could have. So there were times where I didn't, you're kind of deciding things on your own a little bit there too. So yeah, definitely like literally that radiation day, there are probably 5 people in the room and you're sitting there topless with all this gaping stuff. And they're like, well, do you want to keep going? I'm like, I guess I'm supposed to. I don't know. What am I supposed to say? So it's interesting. You don't always know all the information to ask in the moment. But and I guess for us to remember that with our patients too, right? You think they get it, but they don't always get it. Or they're nodding and but do they walk out of the room and don't really know. So how informed is informed consent is a good question.
Okay, excellent. That was a very detailed question. So it was a great answer. Anyone else have any questions at all? Okay, we got another one here.
You kind of ended your story just talking about the importance of connection and connecting with your patients and clients, and you touched on both an experience with the doctor when thinking about chemotherapy, and then being in the radiation room and having the technicians kind of talking about you, but above you and not to you per se.
Yeah.
Was there ever any experience in those circumstances where was it more so that feeling like a task was being completed and you were the task as opposed to a person that was being taken care of and interacted with? And if so, on either side, like how did that make you feel?
Mhm. Well, geez, you guys, good questions. Um, the whole way through the experience, I always had faith or whatever in my caregivers, like whoever was on that team, I felt like I had the best care given to me. And I was told at one point, one of the conferences I attended, which was really weird because I'd go as a physio, but I was there for my own experiences too. Like I went to these genetic conferences, different things. So it was really interesting. But oh God, losing my train of thought. But just sort of the fact that um I had faith in those caregivers. Oh yeah, I was told that in some of those conferences, our care is as good here as anywhere. Like Saskatchewan, you're getting as good in Saskatchewan as if you went to the Mayo Clinic or whatever. So that did alleviate some stress about it. But that example of in the doctor's, the oncologist's office, he was just sort of like, why are you crying? Because I said chemo, and I'm like, yes, I'm freaking out, and it was sort of like I felt like he was kind, but also to him, it's like, this is just every day, right? Versus your first time hearing that, it's not the every day. So I think sometimes we can get a little bit, I don't want to use the word complacent, but I know even in my own practice with, you literally treat thousands of strokes after years, and everyone's different, every family's experience. And I had one of my colleagues, we worked together a long, long time, and she called me on it one time because we were having like a figuring out the day and blah blah blah. And I was said, oh, this lady, mild stroke, it's, she'll be easy. We can have one of the assistants work with her, that kind of thing. And my colleague Erin looked at me and she goes, but it's not mild to her. And boy, that sat me down in my seat because I'm like, you're right, it's not mild to her. You're very right. So I think sometimes we can have that happen. And, I might have had a bit of that for me too, like that radiation piece too. I remember calling the clinic one time and had some questions around the radiation. They got back to me right away and all that. But in that moment where you're there with all these professionals and you're having to make a decision, it's I don't think we don't always, you're in work mode, right? You're as that clinician, you're in your work mode. And it's sometimes tough to come out of that. And you just got to get on to the next one. And you don't ever want to treat your patients that way, even though it's kind of true. You have to get to the next one. So yeah, I don't know if I'm answering your question the best, but it's something to be certainly aware of over time as you get on in your career after lots of people you've seen. And to me, maybe I was a mild form of cancer to them, right? But it sure wasn't to me. So it's the same kind of a thing.
Okay, thank you. Any other questions that we have? No. Okay, so again, let's give a round of applause for Nicole, and thank you very much for sharing your story with us today.
Thanks, everyone.
Definitely, it will be in an impactful day for these students for sure.
Come and do some placements in Regina, everybody. Hope to see some of you down here.
Yeah,
Okay.
do you still take students?
I don't personally
Oh,
anymore.
okay.
I miss that part of it, but yeah. Okay, well, good
Okay.
luck, everybody. Congratulations for being in the program, and yeah, maybe see some folks' faces around here. So thank you, Melissa.
Yes, thanks again, Nicole. I will stop the Zoom here.